And in that press briefing, the governor highlighted that tragic milestone in the state's fight against COVID-19. The first confirmed case of coronavirus in New York announced just 100 days ago. We're joined now by Dr. Stephen Thomas from Upstate University Hospital to see just how far we've come in that time. Dr. Thomas, thanks again for being here.
Thanks for having me.
It's been 100 days since the coronavirus reached New York State. What have we all learned? What have you specifically learned in that time about the virus that you may not have known before, and the progress that we've made in fighting it?
So I think the first thing is that, we should feel pretty good about Central New York's response. So I think the first thing that I learned is that even for a large city like Syracuse with many different organizations and governmental entities, we can coordinate and we can come together pretty quick to mount a response. The second thing is that public health interventions do work. So all the things that we've been talking about for over 100 days now, because we started talking before we had our first case, hand hygiene, respiratory hygiene, and then eventually universal masking and physical distancing, that those things work. And we know they work because the surge that we were at risk of experiencing and the overwhelming of the medical system that we were concerned about, that did not happen. We were able to weather this sort of first wave of the storm. So I think that those are some of the big take-homes in the last 100 days, and they are positive messages.
That is good to hear. And what, if anything, changes now that we've hit this milestone of this pandemic? Is letting our guard down now? Because we're used to this situation, so some people might feel more comfortable about letting their guard down.
Yeah, so that would be a very unfortunate thing if that did occur, and I understand that after 100 days. People are getting fatigued, and with the weather being nice and with a lot of other things that are going on, there is the inclination and the desire for large groups of people and small groups of people, for that matter, to start getting together. And so what I would personally ask is that when people make decisions to do that, that they are smart, that they are consistent in applying those public health interventions that I just mentioned, and that they remember that we continue to have SARS-CoV-2 circulating in the community, albeit at a low level, but we still have the virus here. And that if we're not smart and if we don't continue to be vigilant, that we could see a big second wave, and that's not something that we want to do after all the the hard work that the community's been putting in.
Right, and that applies to the backyard gatherings that we're seeing. What advice would you give to people who want to get people together in their backyards?
Yeah, that's a good question, because whether it's a small gathering or a large gathering, there's always the potential for uninfected people to come in contact with infected people. So I would say, first, try to limit the size of those gatherings the best that you can. The second is I would try to limit those gatherings to the people that and you are aware of how they have spent the last 100 days and whether they've been truly physically distancing or not. By limiting the number of people and limiting the density of people, it's going to be easier for you to try to maintain some kind of physical distance when you're having that event. And for people that are at high risk of a bad outcome if they do get infected, they really need to think hard about whether they want to attend that event. And if they do want to attend that event, then people should make provisions for them so that there can be physical distancing with those people, and even wearing a mask if they can do that. And then, of course, always wash your hands.
All right, and density was not limited this past weekend, though. We saw some of the largest protests yet. People standing shoulder to shoulder, some people not wearing masks. If someone marched in any of these recent protests, should they get tested?
Yeah, so that's a tricky question. So I think the first message is that we're fortunate in Central New York that we do have ample testing available, and so if people do want to get tested, I would encourage them to speak to their medical provider to coordinate the testing, and so that their medical provider can sort of manage their expectations about what that test will or will not tell them. The second thing, and just as important, is they really should be diligent about monitoring how they're feeling over the next 14 days. And if they start feeling ill, they should distance themselves from other folks, and they should speak to their medical provider about getting tested. And then the last thing is that, whenever you have gatherings, again, large or small, there is the potential that people who are infected could be in those gatherings. And so I would encourage people who have participated in these gatherings that in their own home, that for the next 14 days or so, they try to distance themselves from others. They sleep in a separate room if they can, use a separate bathroom if they can, make sure that the pace of cleaning within the household, especially high frequency contact areas, that you pick up the frequency of cleaning those areas. And so again, be smart, be careful, and just be consistent in your application of these public health interventions.
Be smart, be careful. Dr. Stephen Thomas, as always, we appreciate your guidance and your advice and your knowledge. Thank you again for joining us.
Thanks.